Sir, we'll start once we are live. Yes, sir, we are live now. So welcome, my dear students, and welcome to the CareerX episode number 2, Career in Medical. And it's not a typical, we'll talk about entrance examination today, because we have a gentleman here today from the field of medical who has already experienced that. So we'll not talk about examination and academics today. So we'll specific about journey as a doctor. So what is your career in medical journey as a doctor? So today we have with us our expert, Dr. Swagat Dash, who is presently serving as senior consultant and head at Department of Nuclear Medicine and Molecular Imaging at Sarvodaya Hospital and Research Centre, Haryana. And he has done his post-graduation in nuclear medicine and molecular imaging from one of the premier multi-speciality hospital, Sir Gangaram Hospital, which is also called as Gripmar. So he's a medical graduate from MKCJ Barampur University, and he has passed out with the gold medal and distinction in clinical pharmacology and internal medicine. And he has over 15 years of experience in the concerned specialty. And he is also member of many of the organizations or many of the societies like Society of Nuclear Medicine and associate member of the World Association of Radionuclide and Molecular Therapy and WARMTH, which is called as European Association of Nuclear Medicine, EANM. So he's a member of a reputed organization, and he's also qualified Radiation Safety Officer Level 2 from Bhabha Atomic Research Centre, BARC. And really, we are privileged to have such a great, immense personality here over with us in the CareerX. And today, I think it is going to be really a wonderful session and a wonderful knowledge and mind-opening session for the students. So welcome, Dr. Swagat Dash.
Thank you.
So as sir, today we are here for discussing about medical as a journey. So first thing, sir, I would like to ask you out of the script or out of the topic, I will ask, sir. Sir, when you became a doctor, the first time you hold the MBBS degree, so what was the happiness on your face? Or what was that feeling? Can you describe it?
See, actually, I passed my MBBS in year 2004. And I got my MBBS pass certificate in 2000, somewhere in May 2005.
Yes.
So definitely it's a sense of achievement. I mean, after 6 years of rigorous activities, academic activities, everything, and you finally become a graduate, a medical graduate, and you have your final degree certificate with you. Definitely it's a sense of achievement. But that juncture is, again, you are at the crossroad. MBBS is finished, but what next? I mean, again, you will be planning first to join some post-graduation course, again entrance, so everything. So definitely it was a sense of achievement. But for me, again, that time I do remember I was again in tension, because another entrance examination, another, I mean, it's all, you know, I mean, all the students know entrance is all luck. That's all.
Okay. So step by step, somewhere or there is the tension. You clear stage 1, then in second stage there is a tension.
Every stage. I mean, in becoming a doctor, you have to fight with yourself in every stage. I mean, there is a saying, "Dhukote kosto, berute kosto." Matlab, to get entry into the medical stream is difficult. To sustain in the field is difficult. To pass out is difficult. And once you are passed out, it is again difficult.
Okay. So, my God, a beautiful starting of the session, that sir already said that it is not only difficult to be a doctor, but also after becoming a doctor, it is difficult. Very nice.
Yeah.
So when one should think of becoming a doctor, when should this thing come in their mind?
I mean, see, when you have your biology as a subject in 11th and 12th, I mean, definitely you have something in your mind regarding going into the medical field. There are lot of, I mean, for some, this is, they see doctors in their families, so they get inspired. Some see their regular doctors whom they are visiting and they get inspiration. I mean, it's not hard and fast rule. I mean, now this is the time I should think of becoming a doctor. It all depends upon the circumstances and your environment.
Okay, beautiful, sir. So I think the clarity for the student has started. The mind-opening session for the student has already started. But sir, before becoming a doctor, what are the early or prior recognized skill set that individuals should be possessed with?
There is no recognized skill set. Only one thing you need: the patience. Patience is the key.
Okay.
Patience is the key. No other skill set required. And one thing, you should be ready. You should be ready to read, read, and read.
Okay.
Life of a doctor is, it cannot be thought without reading. I mean, once you are a doctor, you have to read, read, and read. Even now, 15 years, my passing of my postgraduate, I daily read. I have to read because medical science is such evolving concept. Every day things are changing, so you have to read. So one is patience, another is you have to be prepared for reading, reading, and reading, continuous reading.
Okay. So students, so patience is the factor which you have to develop from right now, those who are planning. And I believe that today, whoever are attending are planning for medical as a career. So patience and read, read, read. So you should be in love with the thesis, research, and books. How to kickstart the foundation for becoming a doctor? That means I'm talking about the foundation, the mind foundation, physiological foundation, all foundations. How to develop?
See, but I mean, to become a doctor, you need one thing. You should be very good in your academics, number one. Otherwise, you definitely can't crack your entrance examination. So you should be very good in your subjects, physics, chemistry, and biology, number one. Number two, I mean, now the entrance is all multiple choice questions. They are concept oriented. If you are not clear with the core concept of physics, chemistry, and biology, definitely you are not going to crack the entrance at one go. It may take subsequent attempts. So that's the thing. And once you have decided that you want to become a doctor, so ready for the hardship. Be ready for the hardship.
Okay.
Entry is difficult. Continuing is difficult. Exit is difficult. Post-exit again difficult, and life becomes very difficult.
Okay. Very nice. So students, I will make it very clear what sir said is, get ready to accept the failure. And if you fail also, try to come back, prepare again, come back, prepare again, come back, until and unless you achieve.
In my case, I didn't clear the entrance exam at first attempt. No, I took two attempts. In second attempt, I cleared the entrance. So after one failure, if you say no, I have failed, now everything is finished, then what do I do? No, it's not like that. Patience is the key. Patience is the key.
Okay. So that is what my next question is. Is it really, is it a reality or a myth that studies, books, and research never ends for a doctor?
So it's a reality. It's a hardcore truth. I mean, see, medical science is ever evolving. You just see COVID. I mean, prior to 2019, nobody knew anything about COVID. It's a very recent phenomenon. Now the COVID is the number one topic, that is the research, the maximum researchers at this point are going on COVID. So if you don't read, if you don't update your knowledge, then how do you going to practice? How do you going to treat your patients? Every day, new and new medicines are coming up. Every day, new and new diseases are coming up. Management protocols are changing. So if you don't read, if you don't attend conferences, if you don't update yourself with the recent advances, so definitely you will be lagged behind. So reading is the key. Definitely, reading is the key. Without reading, and one thing, and you tend to forget. Medical course is so vast, you tend to forget. I mean, it's a human mind. I'm having a human mind, it's not computer. So if I don't keep on reading, then definitely I'm going to forget things that are not commonly used, or I am not commonly doing, or I am not commonly seeing in my practice. So I tend to forget. So if I don't read, if then how do I refresh my memory, my knowledge? So definitely, I mean, reading and attending medical conferences, these are inseparable part of a doctor's life.
Okay, sir. That's great, sir. But sir, how long it takes to become a fully fledged doctor?
Again, it varies. I mean, what is the concept of a doctor? It has to be seen. If you if someone says no, I only don't want to do MBBS, and after MBBS I'll start practicing as a general practitioner without any specialty, then definitely you will be a doctor after 5 years of course. But if someone is saying no, I want to do a specialization in medicine or surgery or gynecology, then after 5 years again you have to do 3 year post graduation course, so it becomes 8. There are certain specialties, they have super specialties branches like endocrinology. After medicine, someone says no, I want to be an endocrinologist, then another 3 year course. Someone says I want to read brain, I want to read about brain neurology, another 3 year course. Someone says cardiology, I want to be a cardiologist. So only plain MBBS general practitioner, you need 5 to 6 years. Specialty with a core subject as such as medicine, surgery, gynae, then you need 8 years, 5 plus 3. Super specialized branch, heart specialist, brain specialist, endocrinologist, then 11 years, 5 plus 3 plus 3. And these are the minimum time. If you go on cracking all entrances at one go and keep on passing every exam at one go, then this is the minimum time limit, 5 plus 3 plus 3.
Okay. So that means 11 years you are talking about is, if I'll go for PG, after PG, maximum 8 to 12 years is the maximum tenure.
Yes,
which
yes,
if we go by one go, if we clear by one go. So,
yes.
so if it's 8 to 12 years, you need to really, now I can understand the context of sir, that he said that exactly you need patience. Why you need patience is 8 to 12 years to kickstart your career properly. Sir, here I have a doubt from a student. There is a question from a student. The doubt is by Jayant. He has asked that evolution depends on complete luck and chance, or is it done by natural selection?
It's a mix of both. It's a mix of both.
Okay. So luck is also required, and
Definitely.
Even though they need to work hard also, right?
Yeah.
And the second question is, sir, how many years will it take to crack the study of medical, including for MS? I think sir has already answered that question.
5 plus 3. 5 plus 3. I mean, see, with 5 years you will be a graduate. Then another 3 years for post graduation. I mean, you have asked about MS, that is Master in Surgery. So MS is the postgraduate course of surgical branch. So 5 plus 3, 8 years.
Okay. So sir, here is a question, the same question, but I'll just add something in it. How much time it takes to train as a GP and a surgeon, general practitioners?
Sir, I mean, there is no time limit. I'm still learning every day. So it's not that someone is fully trained, now he is ready, but yes, 5 plus 3. For a general physician, you need 3 years of a PG course in medicine, post MBBS, that is 5 plus 3. Or for a surgeon, you again need 3 years of post graduation in surgical branch, post MBBS, so 5 plus 3. This is the minimum time.
So, sir, do I need to be good at, this is again the context from the student, do I need to be good at physics and chemistry to be a doctor?
Yes. Without being doing good in physics or chemistry, you cannot enter into a medical college. I mean,
So,
first you have to crack the entrance. How do you crack the entrance? If you are not at all good at physics or chemistry, only biology won't do anything. You have to be good at physics, chemistry, biology, everything. Number one. Number two, many must be thinking that once you enter medical branch, then there is no role of physics or chemistry. Again, that's wrong. It depends upon subject to subject. Like I am in nuclear medicine and molecular imaging. So my branch has radiochemistry and radiation physics, both. There are certain branches where you, like the general branches, general medicine, general surgery, where there is no role of physics or chemistry per se in day-to-day life. But radiation oncology, nuclear medicine, radiology, these are the branches who are hardcore. I mean, we read physics or chemistry as much as any other non-medical branches do. I mean, we have papers. When I appear for the postgraduate examination in nuclear medicine, there are one paper on nuclear physics, one paper on nuclear chemistry. So definitely you have to have a knack for physics and chemistry. Without having a liking for physics or chemistry, no way. You cannot enter a medical branch and you cannot sail through also.
so this is the first highlight, my dear student. Those who think that physics is, if I can score just qualifying mark in physics and chemistry, and I can be a good doctor. So my dear students, you have to focus on physics and chemistry at par level, parallel to biology.
Yes. Yeah.
So, sir, what are the major differences in studying abroad and India? Because these are the questions, because those students are not able to clear the entrance exam. So directly they are targeting abroad. So what is the difference between abroad and India?
See, if I go through the curricular part, curriculum per se, there is absolutely no difference. But thing is that usually students head to those countries where medical per se specialty has not evolved. They don't go to US, UK, Australia. They go to ex-USSR countries, Philippines, Nepal, where medical as a sector has not evolved, or it is lesser than India. So it's or and another thing, many countries they ask to read medical science in their own language, not in English, in their own language. So if someone is passing out MBBS from that country with knowledge in their language, it becomes difficult for him or her to adapt in Indian setting. Otherwise, curriculum-wise, there is no difference. There are other. I mean, if you learn a disease, if you learn to know the symptoms of a disease in other language, when you come back to India, so how do you interact with the patient? I mean, patient will say something, you will understand as something else. So it becomes difficult. So, but curriculum-wise, there is no difference.
Curriculum-wise, no difference. Okay. So students are thinking of like Ukraine, Philippines, Indonesia, China. So they have not.
China is good. I have seen students from China. They have good skill sets. But rest of the country, I usually don't know why do students they don't. I mean, in China also they learn in Chinese. There are certain universities where the medical curriculum is in Chinese language, and there are certain in English language. Those who are from English language curriculum, then definitely they can adapt better. But other language, if they learn the things in other language, it becomes difficult. It becomes difficult. But what I know is curriculum-wise, there is absolutely no difference. If someone is not getting a chance in India and he has a scope to go abroad, then he should. He should.
So what is the scope of doctor in India who had studied abroad, who has already gone abroad and studied? So what is the scope in India?
See, in abroad, when you do graduation in medicine, that is MBBS, when you come back to India, you have to appear for one foreign medical graduate record exam. You have to appear that is being conducted by National Board of Examination, and you have to clear that exam. If you clear that exam, then only Medical Council of India will accept you as a doctor, and you will get registered. If you can't clear that exam, then you are at crossroad. You cannot practice medicine in India. So number one, you have to clear that exam. But if you are coming as a postgraduate, you did your graduation from outside MBBS, then you did some post graduation in let's say medicine, surgery, anything you did, and you came back to India, then be clear that that postgraduate degree is not recognized in India. India only recognizes MBBS degree from outside, provided you clear the foreign medical record graduate examination, then only your MBBS will be recognized. Whatever the postgraduate degree you have done there, it has no recognition. MCI, that is Medical Council of India, does not recognize it. You have to again appear for the entrance examination for post-graduation.
Okay. So that's a big line. So students, those who have ever planned about going abroad, so you can go for MBBS, but post-graduation, always prefer India as a country. So very nice that till now interaction is going, and I can see the chat box is flooded with the questions. And I would like to put out one or two questions again. So we are short of time. So here a student is asking a question: Do I have to do super specialization to be a dermatologist?
No. Dermatology is a specialization branch. You need to do a post-graduation in skin VD, that is skin and venereal diseases. This is the post-graduation course. Then after dermatology, you can go for super specialization like trichology, hair transplant, plastic surgery, dermatological surgery. These are the super specialized branch of skin. Otherwise, to be a dermatologist, you need 3 years post-MBBS.
So the another question is, can we do post-graduation abroad after clearing MBBS in India?
Yeah, definitely you can do that. Many students, they head to US, UK, Australia, but again, you have to pass their foreign medical record graduate examination. Then definitely you can help.
So one more interesting question, sir. It usually happens like many people are good in biology and physics, but not much good in chemistry or not good in physics. Their score come up like 60 to 70%. Will they be able to pass NEET?
Definitely you can. If you are, see, when you are scoring 60 to 70% in physics or chemistry, it's all theory, long question, short question. There are various types, but to clear NEET, you need to have thorough knowledge regarding multiple choices. If you prepare hard, then definitely you can crack. You have to prepare hard.
Sure, sir, sure. So here Jayant has one more question. That's what are the topics taught or been researched in nuclear medicine?
Oh, nuclear medicine is a quite new branch, Jayant. This nuclear medicine branch came into existence in somewhere around 1990s. When I passed out my MBBS in 2004, I did not know anything about nuclear medicine. I passed out from Odisha, came to Delhi. When I came to Delhi, then only I saw one board of Department of Nuclear Medicine in AIMS. Then I started researching what is nuclear medicine. Nuclear medicine is a fairly new branch, and there are a lot of research going on application of radioisotope in the management of cancer patients. Actually, nuclear medicine deals with radioisotopes. We deal with radioisotopes. So it's a lot of research going on, application of radioisotope in the diagnosis, treatment of cancers.
So I think Jayant, sir, answered your question very well. And then my next question is, what is the career scope of a doctor who has studied from a government or a private? Different. I'm asking about what are the scope for the government and private medical college.
I'll say there is no difference. If you say theoretically, there is no difference. But practically, what I have seen is the one student who has passed out from a government medical college, he has wider exposure to wide variety of patients. See, because government medical colleges are associated with government hospitals, private medical colleges are associated with private hospitals. I mean, most of the people in our society, they cannot afford the treatment in a private hospital. So most head to the government hospital. So when you are studying in a government medical college, which is associated with a government hospital, you tend to see more number of patients, varieties, varieties of disease, and you can experiment on them. See, on day one, when you start treating a patient, I mean, you cannot guarantee that you are going to cure him absolutely from the scratch. So when you start your training on patient treatment, you need to have a lot of experiments, and you cannot do experiments on private patients. I mean, in government hospital, there will be a lot of caseloads, and you get to know, mix and match. This medicine, okay, this is not working, then that medicine, why the dose. Definitely your teacher will be there to guide you, but you will be treating. So that freedom is much more in a government setup rather than in a private setup. So ultimately, students who are coming out from government medical colleges, their skill set are definitely better than those coming out from private medical. But it's not absolutely true. There are certain private medical colleges like KMCH Mangalore. I mean, their students are also very good. DY Patil Medical College, Pune, their students are also very good. So it's absolutely, theoretically, there is no difference. Theoretically, no.
So my next question is it true that private medical colleges has a better lab facility and practical exposure?
They may have a better lab facility, yes, because they have resources. They may have a better lab facility. But practical exposure, no. Practical exposure definitely in government setup will be much more than private medical college.
So here, the very good highlights Dr. Swagat has made, that if you are looking for a better medical lab facility, then you can think of option as a private. But if you are looking for a better practical exposure, then government is a best option for you. So here, the government versus private war, I think Dr. Swagat has beautifully bifurcated that. I think students, you have got your answers, whatever you are questioning. And yes, Jayant, please hold on. After every 15 minutes, I will be posting your question to sir. So every 15 minutes, right? So have patience. And sir, really, I'll tell you, the chat box is completely flooded. And the students, I'm getting a feel that these students, just after this session is over, they are going to study or practice NEET as well. They have a lot of questions. And sir, how is there any financial pay or stipend while getting trained to be as a doctor?
No, initial 5 years definitely there will be no pay, no stipend. But after MBBS course is completed, you need to have a compulsory 1-year internship, rotational internship. That means you will be posted in various core branches of medical, like medicine, surgery, orthopedics, gynecology. You will be posted. So that time you will get stipend. But initial 5 years, no stipend.
So, sir, as we are talking about stipend and salary, so there is also a myth between students. So students always, when they come to me for counseling, they ask that after if I study in a government college, will I get a better salary? Or if I go for a private college, I'll get a better salary. So what is the career scope for medical fresh graduates after their training and experience, everything is complete?
See, once you are a fresh graduate, that means you have completed only MBBS and 1 year of internship. Then after that, wherever you go and wherever you work as a junior resident. Immediately after post-graduation, immediately after graduation, you work as a junior resident. So junior resident pay structure, it is different. It varies from state to state in India, I am talking about. Here, because I practice in Delhi, so I have a fair amount of idea regarding Delhi. Here in junior resident, fresh pass out MBBS, if someone is working in a government hospital, he gets around 42 to 45,000. And someone is working in a private setup, then it varies between 30 to 45,000. This is the basic. Then when you get into a post-graduation course, you get stipend. That again varies from state to state, college to college. There is no uniformity. When you passed out after post-graduation, I mean, now you are a doctor, you are a specialized doctor. Then again, it depends how you sell yourself. If you are joining a government setup, then definitely there are certain norms, UGC scale. The pay scale will be same for everyone working in government. Then you need to see whether it's a state government run hospital or a central government run hospital. Then pay scale are better in central government run hospital other than state run hospital. But if you are going for a private setup, or you are planning for a private practice entirely out of any institution, then it's all depends how you sell yourself. I mean, it has now become a business. Medical in private, it's a business. If you sell yourself good, you sell yourself smartly, then definitely you will earn better. That's it.
From my side, sir, again, I'm putting a light on whenever I'm into counseling. So students have a very different criteria when they come. Some are very straightforward. They just give their objective that why I want to study medical. So medical is all about, sir, service to humanity. Being a doctor, is it a service to humanity, luxury, or it's all about self-esteem and respect in a society?
Everything what you have said except luxury. I mean, doctor doesn't get time to splurge in luxury. Maybe doctor's family, they may splurge in the luxury. Doctor doesn't get time. But definitely, it's a service to humanity. Definitely, self-esteem is good. Definitely, you get a lot of respect in the society. So all those are there. But luxury, I don't. I mean, hardly someone hardly finds. I mean, if a doctor is doing good, that you can only do good in your hospital, in your branch, when you devote a lot of time. If you don't devote time, then you can't excel in your career. So if you are excelling in your career, that means you are devoting time. If you are devoting time, then you have no time for yourself.
Okay. So my dear students, so sir has made it very clear. So even though you can earn more, you can live in a luxury, but you cannot ever take the advantage of that luxury being a doctor. Yes, your family may have that. Yes, you can see a doctor riding a Mercedes or a doctor riding a Audi, but yes, it may not be the need of a doctor, but the need of their family also. So probably, if you want to be a doctor, so keep the luxury factor as a part, and self-esteem, respect, and humanity is the first thing which you should carry. Sir, here I have a beautiful question from James saying that, sir, which college is better, AIIMS New Delhi or SCB Medical College?
Definitely, AIIMS New Delhi is far better.
So for SCB Medical College, James, you have to work hard and you have to score into All India quota. And Rajeshri is asking about NEET. So Rajeshri, next Sunday, we are going to have a NEET specific session from a competitive faculty. So today we are only discussing about doctor. So have patience. Next Sunday, you will get answers to your question. And Dipti here is asking about, sir, do we have to apply in hospitals for practicing after completing PG, or super specialization, or the process is different?
Definitely, after passing out your post-graduation, you need to apply to different hospitals wherever there. You need to look for any vacancies there. Then definitely you have to apply. Yes.
And Jayant has again a question that, as we mentioned cancer, sir, may you please say that cancer is just uncontrolled cell division or cancer is something else?
Uncontrolled cell division is the basic thing, and there are many things else, not something else, many things else.
Okay. And Rutu has asked that, sir, what is the super specialization course if I want to get into pathology?
Pathology is the post-graduation course. I mean, after MBBS, after doing your 5 years of MBBS, you enter into pathology is the post-graduation course. After pathology, you can, I mean, the super specialized branch are oncopathology, hematopathology, clinical pathology. You can diversify into super specialized branch. But pathology per se is a post-graduation course. It's not a super specialized branch.
Okay. And sir, here one more student has a question. The last question I'll be taking. Sir, I'm interested for career in medical sciences, but I realize I lack patience. What shall I do?
You need to practice a lot of yoga and learn how to be patient.
Okay. Yoga is the mantra. So
Yeah.
I have Shashwat asking this question. So Shashwat, you need to do yoga and you need to read a lot to create a patience. And so moving toward our next question further with, sir, I want to be a doctor. This is many students have asked me this question. Sir, I don't like blood. I don't like the surgeries. I don't like to treat patients. But yes, sir, I want to be a doctor and do research, or I want to go into research, but do not want to treat patients or perform surgery. Sir, is it possible?
Yeah, there are certain branches. There are certain branches who are mainly focusing on research. I mean, after MBBS, there is a subject called pharmacology. You can specialize in pharmacology. Another subject called PSM, that is preventive and social medicine. You can specialize in PSM. There are other branches. Few more branches are also there, which are, I mean, definitely, if you don't want to treat patient, you want to go into hardcore academics, hardcore research, you choose your subject accordingly.
So, sir, if a student is planning to become a professor or a lecturer in the college, in the medical colleges, what shall he or she should do?
If you want to become a faculty in a medical college, you should have a very good academic track record. That means you should, I mean, when you apply for a facultyship in a medical college, they don't just see your medical career. They see what was your percentage in your 10th, how did you do in your 12th, then in each and every examination of MBBS, first prof, second prof, third prof, fourth prof, how was your grades, any distinction in any subject, any gold medal in any subject, all those matters. Your career from 10th till last examination in medical field, everything matters.
Okay. Sir, if a candidate want to go for a private medical colleges, they are looking for a private medical colleges in India. Probably they are not able to crack the entrance exam, but yes, they do not want to give up their medical as a dream, being a doctor as a dream. So what are the best name in this nation, the colleges names in this nation, which you will suggest to students for private?
There are very few, as far as my knowledge goes, that take students purely on the basis of donation. There are very few, but definitely one is KMC Mangalore, KMC Manipal, and DY Patil Medical College, Pune, and one more is there in Bangalore. That is MS Ramaya Medical College, Bangalore.
So
They do have management quota. They do take patients. They do take students purely on the basis of payment, but detail, I mean, it varies from academic year to academic year, student to student. So that's it.
I think students, sir, has given the names which are the best medical colleges you can go for private in India. So I think you have noted down. So those who have not noted it down, the YouTube session is live now. You can get back to CareerX YouTube live channel. You can subscribe and you can get the names of colleges there. So next is, what are the eligibility criteria and entry routes to study medical abroad?
Actually, there are few countries, they do have their entrance examination, separate entrance examination. But most of these countries, that is ex-USSR countries, China, Indonesia, Philippines, I mean, just the payment. You
Okay.
don't need to, just the payment, and you should be having at least medical subjects in your 12th and payment.
Sir, as you said that in the earlier question, you said it that students need to pass the Medical Council of India examination. Is it for the countries those who are inferior to education or inferior to the medical studies abroad, or superior to the medical studies about India?
No, 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 no. Everyone, if you are coming from US, UK, Australia, any countries, if you want to practice in India, then definitely you have to be registered with MCI, that is Medical Council of India. And to get eligibility to be registered with MCI, you need to pass one exam. That examination is Foreign Medical Graduate Record Examination. That you need to pass. Be it any country. It's not that, I mean, US, UK, they are superior. So students coming from US, UK, they don't need to sit in the exam. No, it's not like that.
Okay. So, sir, how tough is this examination, FMGRE, which you said is Foreign Graduate Medical Entrance Examination? How tough this examination is?
It's tough. It's tough. How tough? How tough? I can't comment, but definitely it's tough. It's not easy. It's not easy to. It's not like a cakewalk.
Okay. So I would just like to add on to what Dr. Swagat said. Yes, it is tough. It is not only tough, I would say that it is very tough, because out of 60 to 70,000 in 2020, only 2% were managed to clear the examination. Only 2%, which is a very less figure. So it itself defines that how tough it is. And so, how to avail a license and practice in India after completing medical education abroad? As you said, MCI. So what are the process in that involved?
First, you need to clear that foreign medical graduate record examination. Once you pass that, then you get a provisional registration with MCI. And with that provisional registration, you need to be attached with a hospital, with a teaching hospital, to for 1 year mandatory internship. During that internship, you will be posted in the core subjects of medical branch, that is medicine, surgery, gynecology, and uh, orthopedics. These are the core subjects. So you will be posted. Then you will be learning the things which are being done on the ground in your hospital. I mean, see, somebody is coming from China. In China, there are many diseases which are prevalent only in China. They are not prevalent in India. In India, there are many diseases, they are prevalent only in India. You hardly find those diseases outside India. So during that 1 year period, you will be acquainted with the diseases prevalent in India or in your state or wherever you are working. You will get acquainted. Then after that 1 year, your provisional MCI registration will be upgraded to a permanent one.
Okay, so I think it's a very valuable information for us being a counselor. We didn't knew about all these things, that yes, 1 year they have to dedicate, and some of the diseases which are rarely found in India, and but it is not found in other countries, and probably this is a very valuable.
Actually, the common disease like malaria, tuberculosis, most of the foreign medical graduates, they don't read about malaria and TB, because those countries, malaria, TB, they are rare. But when you come down to India, when you come down to Odisha, if you don't know anything about malaria and TB, then you are gone.
Okay. So, my dear students, those who have ever planned to go for foreign and study medical abroad, so life is even double tough for you.
Yeah, agree.
And sir, here I have again some questions. A beautiful question. I think I would love to answer this, and it would connect you also. Sir, is it necessary to work for 8 to 9 hours for a doctor? And is it hard for a doctor to have a own personal time, like having holidays?
No. It's not at all compulsory to work so hard. If you don't want to work, then don't work. No one is forcing you, but you cannot excel. If you don't devote time, then you cannot excel. You will be a mediocre doctor, right? So if you like being a mediocre, then fine, absolutely fine. No one is forcing you. But if you want to be the best doctor, if you want to be the known as the best doctor in the town, how will you be the best doctor if you don't devote time?
Yes, exactly. Absolutely right. So my next question is from Jayant, who is asking, sir, where and when can I get to know about many things else in cancer? You are going very ahead, Jayant.
Jayant, when you do MBBS, after that you have to do 3 years of post-graduation in general medicine. Then you have to do 3 years of super specialization in medical oncology. Oncology is the study of cancer. Then after that only you will get to know the many things of cancer.
Sir, I can hope you can connect, sir, how far these students are going and thinking. Probably in
Yes.
your time or my time, we were not thinking like that.
No, no, no.
And again, we have a question that, sir, if you are a doctor in India, will be given opportunities to treat patients in other countries. Is it possible?
Yes, but suppose you are passed out from India, you did your graduation, post-graduation from India, but you want to relocate to another country to practice, then definitely you can do that. But for that, you need to get registered with that country's medical council. Like we have Medical Council of India. If you're planning to relocate to US, UK, or Gulf countries, you have to be registered with their local national medical council. So for that, different countries, they have different parameters, different guidelines, and different requirements. You can check on that.
And here Swati has one more question. Do I have to do PG to be a highly paid medical professor, or MBBS is all we have to do?
MBBS is jack of all trade, master of none. So definitely it's less paying. You have to do post graduation to be highly paid. Yes.
So Swati, you don't have a third way out. Yes, you have to go by the process, MBBS, then PG, then only you can be a highly paid doctor. And yes, you have to work hard also, Swati. So, sir, before I go with the other question, my last and final question to you, sir, what suggestion, mantra, advice you want to impart for medical aspirants, those who are there with you right now?
Only 4 things: dedication, patience, hard work, and a bit of good luck. That's all.
Okay. So I think students, you have got that. For being a doctor, these are the 4 mantras which Dr. Swagat has said. You have to work on it to succeed in your life in the field of medical future if you are looking for it. And sir, again, I'll be going to next question from the students. James has a question, sir. What are the courses in cardiology in super specialization and PG?
See, cardiology is a super specialized branch. For that, you need to first complete MBBS, then you have to have a post graduation in general medicine, then you go into cardiology. Again, cardiology it has 2 bifurcation. One is non-invasive cardiology and another is invasive cardiology. So when you are going into non-invasive cardiology, you only see patients and that's all. But invasive cardiology, it includes everything of non-invasive cardiology. Apart from that, various intervention procedures like we must have heard a stent in the heart, pacemaker in the heart. So those are being done by the intervention cardiologist.
So, sir, after completing, can I become a PG surgeon in cardiology after completing PG?
Surgeon in heart surgeon, you mean to say?
Yes.
Again, that's a surgical branch. So again, you need to qualify your MS surgery, I mean post-graduation in general surgery. Then you have to have a super specialization in cardiothoracic surgery.
Okay.
One is general surgery, then after that, cardiothoracic surgery. CTVS.
Again, from the student's perspective, sir, I have one last question. That is, in PG, after completing the PG or after clearing the PG examination and completing PG, what all surgery courses we can opt for? What are the options available in surgery?
After PG, you have oncosurgery, that is cancer surgery, you have endocrine surgery, you have brain surgery, brain and spine neurosurgery, you have cardiac surgery, you have plastic surgery, you have urosurgery, urology, urosurgery, and yeah, these are the main.
So next question is from Sudhanshu, Sudhanya. Sudhanya, after MBBS graduation, is there any management courses in medical field?
No. I mean, one subject is there, that is PSM, that is preventive and social medicine. It has a small subset of management course, but as such, there is no management course after MBBS.
Then James again have a question. Sir, what should we do for be a faculty in medical school? I think sir has already answered this question, James. So what do you want to become? Medical faculty?
You have to excel from the very beginning. Your 10th, your 12th, all the MBBS examination, then your post-graduation, everything. You have to excel in everything.
So that's all, sir. Here we come to the end of the question. So student, if you have any questions or queries, we will only wait for 30 more seconds. If you have any questions, you can come down with the questions. So probably, sir, thank you so much, sir, for being here with us, giving us your valuable time. And really, sir, this was a mind-opening session. The saucers which were kept like this, now today, after being interaction with you, the saucers have become this open. So it was closed, now it has become open. And really, it was a very the session which has contained a very indigenous information, which even being a counselor also I didn't knew. So it also opened the eye for me. And the best part was that, sir, when you said that, yes, studying medical abroad is because students are fascinating now a lot about abroad when they do not grab, because the medical studies are cheap there, exactly which the countries you pointed out, Ukraine, Philippines, Indonesia, they are going for these medical studies. So students, if you are planning, then I think, sir, correct me if I'm wrong, if you are planning for medical studies abroad, choosing US as a country, Germany as a country, or Spain or New Zealand as a country would be good for you, rather than going for countries which are inferior in evolution than India. So it makes you more difficult. So probably this was an eye-opening session for me. And thank you very much, sir, for being here. And before we close this session, there is a last question which I will answer on your favor, sir. Can one be a doctor without giving NEET? Yes, you can be a doctor without giving NEET, but not in the government colleges, my dear. You have to go for the private colleges. And if you want to have the list of the private medical colleges, sir, can you please repeat once again that list of private medical colleges?
One is KMC Mangalore, KMC Manipal, DY Patil Medical College, Pune, and MS Ramaya Medical College, Bangalore.
So, thank you so much, sir. For
I just want to add one line to this your previous question. Being a doctor without giving NEET, I mean, shortcut to success is not there. You always don't have the shortcut to success. If you become a doctor without giving NEET, then you can't be a good doctor.
Okay. So yes, she has also written here that yes, sir, I understood that. I kept your word and noted. Thank you so much, sir, for being there with us. And really, it was a beautiful time spending with you, learning about medical and a doctor. Without being a doctor, I could know a lot about medical as a career option. And really, whatever has been done in this COVID scenario, sir, you and your fraternity has really done so much for us, like a humanity. They have been, when we listen COVID or Corona, we get a lot of fear. And I think 2 months back, my family got affected with that. So I knew what were they going through. And every day, this doctors fraternity go and treat those patients, and they stay in the danger. I would say that they are on the war front, not in the medical. They are in the war front and they are fighting. And sir, really a huge respect from me and my students from ODM. and really you are doing a good, and we would pray that God give you a grace and even though long life to treat us.
Thank you.
Thank you so much, sir.
Thank you.
CareerX
Thank you.
signing off.
Thank you.